Hello, everyone. Welcome. Just bear with me as I let a few people in through the lobby. I'm Chandrika Gibson. I'm here hosting this webinar for Breast Cancer Care WA, and I'm joined by Dr. Joshua Wiley. Before I properly introduce Dr. Joshua, I wanted to acknowledge the lands that we are on and the traditional owners of this Budja, this country. So I'm streaming live from Whadjuk Noongar country in Perth, Western Australia. And I know that many of you are here in WA, but also elsewhere. And Josh, what lands are you on?
I'm coming to you from the lands of the Kulin Nations.
Wonderful, thank you. So introducing Dr. Joshua Wiley, he is a behavioural medicine researcher at Monash University with a focus on understanding and improving conditions for people living with and beyond cancer. In particular, today he's going to be talking about sleep and mental well-being. He's a senior research fellow, which is equivalent to assistant professor in the School of Psychological Sciences and the Turner Institute for Brain and Mental Health. He studied health psychology and behavioural medicine, completing his PhD at the University of California in Los Angeles in 2015. So I'm going to hand you over to Josh, and we're hoping to generate a bit of discussion today. So if you're not familiar with using the Q&A or chat box, if you just hover your mouse somewhere along the top or maybe the bottom of your screen, you can use either the chat or the Q&A. I'll be keeping an eye on both boxes. So please do put any questions or comments in there, and Dr. Joshua will respond as we go along, and we'll see how we go. Over to you, Josh.
Thank you so much. So just really to start off, I would like to echo what Chandrika said. Really happy to take questions and really happy to have discussion. I think I have prepared some content to share with you, but I think the most value will come out of this meeting when I hear from you and we're able to make this something that really aligns with your interests, your questions, something that's been nagging or bugging you. And certainly if anything that I say is confusing or things like that, do ask. The other place I think is really great on top of questions, if you have comments to make. So I may make a point or may say something and you have experiences that align with that, or you've had very different experiences. Please chime in with comments and these sorts of points. I think people and humans, every one of us is unique and has unique experiences and unique sort of pathways, and where we'll have overlap and shared across them. And I'll share some kind of general patterns, I guess, that we know from research and other work, but there'll be a lot of richness and nuance that each of you bring. And so would really love for you to bring that into the session and to be sort of truly participants in it, not sort of just an audience. If you're comfortable only, of course. Okay, with that said, I'm talking about sort of sleeping well after cancer. I've popped my email here at the bottom, and I'll put this up again at the end, but I'm really happy to take questions or sort of follow-ups after the session as well. Just a little bit of an overview of some of the sorts of things that I want to talk about today or sort of share with you. I want to talk a little bit about, and this is sort of probably preaching to the choir, cancer-related challenges. Some of why can sleep be particularly difficult after cancer? I'm going to go over some sleep basics and sort of just some foundations of sort of what is sleep and what are some basic things that can help sleep. And then I'm going to sort of spend more of the time talking about steps we can take. Got this last section on sort of what is the evidence, where I have sort of information about a number of different evidence-based supports or programs for sleep. And I won't necessarily talk about it today, but I do have sort of content there. And if we have extra time with this particular interest, can always sort of hop into that. So just to start off, and I think you will probably all be familiar with a number of these things, but maybe it sort of helps set the stage to think together about what are sort of the pieces or the aspects of cancer, that perhaps are particularly challenging to sleep. And there's quite a few of these actually kind of cutting across both, the more medical or the biological side of cancer. And so there we think about stuff that the tumors themselves may do, inflammation that surrounds that, which can impact on sleep, and of course, things like pain. there's a lot of psychological and psychosocial factors that contribute. And so we know that very often, of course, cancer diagnosis and its treatment are quite stressful. And there may be thoughts or worries or anxieties about what does this mean for my life, or what does this mean for what's going to happen. And the stress and the pressure of these things can also, induce these feelings of sort of depression or sadness. And these kind of psychological factors influence how we sleep, whether we're able to sleep. There's a lot of behavioral changes that occur. And so, sort of a major one, and I sort of put this under this broad category of behavior, but a major one would be things like hospitalizations. When you have surgery and you're in a hospital, that environment is different. The timing and the routines are different. And for anyone who's spent time in hospital, obviously they're not typically great environments for sleep. But that might be quite acute, but it sort of puts you into this, it's a very sleep disruptive in that phase. And then even when you sort of come home, when you sort of disrupt sleep, it can take time for it to sort of get back to where it was. Or if there's enough other changes, it can be really hard to ever get it back to sort of where it used to be. Something else that we know that happens is a lot of people will take time off of work. And even if you're able to continue working or whatever other things you had, right, your routines get disrupted. And as we'll talk about a little bit more when I talk about sleep basics, our routines are really important for our sleep. And so when those get thrown off by something major, like cancer diagnosis, cancer treatment, etc., then that can be a challenge to sleep. And, well, often there's going to be more tiredness and kind of fatigue, which can lead to napping, and napping can lead to changes to sleep. And then, of course, you have the cancer treatment. And so things like chemotherapy, surgery, radiotherapy, and they all come with a whole lot of side effects and consequences that can make sleep more challenging. And so this is just sort of a bit of an overview or a bit of setting the stage about some of the things that when you kind of get a cancer diagnosis and the treatment and everything that goes with that can make sleep quite challenging. Now, I want to talk a little bit about some kind of just a few numbers and kind of stats, if you will, about some sleep related disturbance that we know. And I've sort of put this into a few different categories. So we can think about insomnia symptoms, so those kind of nighttime trouble sleeping. We talk about that as difficulty either initiating, so that's falling asleep, or maintaining or staying asleep, right? So you might have trouble where you lie down in bed, but you don't get to sleep. Well, some people will lie down to bed and they fall asleep, but then they wake up repeatedly throughout the night, right? So it's sort of difficulty staying asleep. And what we know is that while there's various rates of how many people experience this, it'll be upwards of over 60% of people will experience some problems with these kind of insomnia symptoms after cancer. It's about twice the rate that you would expect in people without cancer. We can talk about fatigue, and we talk about that as a state of weariness. Fatigue isn't just about sleep. You can have slept well and still be, very fatigued, especially after cancer. But of course, if you don't sleep well, then you're more likely to also have fatigue. And we know that somewhere around 3 out of 4 people with cancer will experience at least some symptoms of fatigue. And for many people, this can be reported as one of the most disturbing sort of we call it here subjective complaint or experiences. That is to say, sort of, I guess, separate from obviously, the cancer itself might be a major concern, but that sort of fatigue, that lack of energy, really impacting on a lot of daily life or daily functioning and being, quite kind of disturbing or bothersome in that way. And then we can think about disturbances to our body clock. And I'll talk a little bit more about the body clock later. But our body clock is this kind of 24-hour cycle, right, of day and night, of sleep and wake. And it really contributes to regulating sleep and fatigue or the energy levels we have. And when it's disturbed, and we know that cancer and its treatment disturb this, then that can also lead to challenges with sleep, like insomnia or fatigue. And just a couple of little bit of other little bit of data, just very briefly to give you some sense. This was a study that we did a few years ago, and we followed 460 women, stage 1 to 4. So they had anywhere from early stage to metastatic breast cancer. And we followed them from diagnosis up to 15 months after diagnosis. And we were able to use some statistics to kind of group them into the patterns of insomnia symptoms that they experienced over time. And that's shown in sort of these different lines here. And so what you can see is that there was about 14% of people that pretty persistently from diagnosis and even over a year after diagnosis, when most of them would have finished treatment, had high levels of insomnia symptoms. Another really big group, 66%, about 2 in 3 women, had sort of elevated levels. So they weren't super high levels of insomnia symptoms, but they weren't sleeping well. So they were sort of in the middle. And then around 20% had sort of good sleep, and they had good sleep throughout. But one thing that I think is striking here is that this can happen, and these kind of challenges with sleep can happen anywhere sort of after diagnosis. So it can be quite early on. There's a lot of psychological changes that happen right around diagnosis, right? Where you're confronted with this potentially very threatening thing. And then you get into treatment. But even when treatment's often ending, for most of the women in our study here, they would have been finishing treatment around 6 to 9 months. But we see that a lot of their sleep problems keep persisting as long as we follow them. We only followed them for 15 months, but we know from other data, even if you look further out than that, a lot of these problems sort of persist. So it is quite normal, I guess, to have some trouble sleeping and for that to happen anywhere after a cancer diagnosis, during treatment, after treatment as well, they can persist. And then just a few other things that we know can be that we found are related to this. So what happens when you have some sleep problems, or what sort of predicts it? We find more experiences of chronic stress, more experiences of depression symptoms, more experiences of anxiety symptoms, and that those with some of the worst sleep were actually a little bit younger. So that's just a little bit of a very kind of high level overview of some of the aspects around cancer that can make it harder to sleep. Any comments or questions there before going on? Experiences that anyone here would like to share? Thanks, Tina, around that sort of it mirroring your experience. And then Chandrika, you had the question, can you explain the inflammation and insomnia link? Which I'd be happy to. So inflammation is um, a, basically kind of our immune system becoming more active. Um, and it often goes along with sort of sickness. So the thing that the clearest example that I like to use here um, is not even sort of cancer related. If you think about whenever you get sick, right? So if you get a cold or flu, an elevated level of inflammation, and you'll probably also experience this kind of range of other symptoms. And those might be that you're extra tired, that you sleep a little bit more, and that you withdraw a little bit socially. And you might not experience all of those things, and different people will experience them to different levels. But we kind of broadly call those these kind of sickness behaviors. That's that kind of that fatigue, that tiredness, the kind of that drive to sleep a little bit more, and that kind of little bit of social withdrawal, right? Where you basically like you're sick and you want to just kind of curl up in bed. And what we know is that those symptoms are not really just caused by like when you get a cold or a flu. They're not caused by just having that cold or flu. They're actually caused by the body's immune response to it, to that inflammation that happens in our systems. And that's able to basically send signals up to our brains that says, hey, I'm not well, rest and pull back and sort of recharge. And the sort of the thinking is that that might be evolutionarily adaptive to when you are unwell, to basically, you know, quiet down, stay home, rest, relax, try to recover. And so in cancer, of course, it's not the same as cold or flu, but we have some of that same kind of inflammation can occur, and it can occur from the tumors themselves and what they're doing to the body, and as the body tries to fight them. It can occur when you have surgery, which causes obviously a wound to the body, right? Even if we're doing it to try to ultimately heal and help, the surgery acutely, causes damage to tissue, and this causes the body's kind of immune system to react and respond. And chemotherapy and radiotherapy, we know as well, trigger inflammation. So basically, all of your kind of major anti-cancer treatments um, tends to lead to higher levels of inflammation. And then we know then that that inflammation can sort of make you more tired, more wanting to kind of try to sleep. But it doesn't actually help you sort of sleep well at night. It sort of makes you want to sleep, but without necessarily being able to sleep particularly better. And so I think we would basically from these sorts of things expect that kind of that drive to try to sleep and that a need almost for more sleep, um, while often probably struggling to actually get restful restorative sleep. All right. So the next little bit that I want to talk about is just some basic foundations of sort of what is sleep, and what are some of the core pieces that help it. Again, even sort of between sections, please do feel free to chime in. The one thing that I want to sort of um, have you all sort of think about is what causes sleep problems? Sort of why do we have sleep problems? And I want to sort of expand on beyond just being like my sleep wasn't good or I didn't have a good sleep to thinking about some different factors that may be driving it. And that'll help us when we sort of switch gears and we start talking about, well, what can we do about it and what steps can you take to sleep better? And so, simple one, and I think this often doesn't necessarily apply that much in cancer, but it can, is sort of what we might call sleep deprivation or restriction, a lack of opportunity. This is what we think about when we talk about maybe adolescents, right? Or kids who sort of they want to go to bed later, and then they have a really early school start time, and so they wake up early. So they go to bed at midnight, but then they're supposed to be at school at 8 a.m. and they got to wake up at 7. And so they have a restricted opportunity to actually sleep. This might be if you also have work or things like that, that for whatever reason you sort of stay up later. We can think about what we call sort of in the scientific or medical term, we call circadian rhythm. I will talk about that as our body clock. That's that 24-hour cycle of normal sort of I'm awake, I'm asleep, I'm awake, I'm asleep, right? And we cycle back and forth, and that lasts about 24 hours for most people. And that body clock doesn't have to match the the time of our lifestyle. And so we can talk about a mismatch between our body clock and our lifestyle. So let's say that my body clock says I should sleep from 4 a.m. until noon, but I've got work that starts at 9 a.m. Well, now there's a mismatch between when my body wants to sleep and when I need to be awake to get to work. And that mismatch will cause problems with my sleep because my body is going to be saying, be awake here, be asleep here, but my work is saying, be awake here and be asleep somewhere else. And that mismatch can drive sleep problems. Um, we'll talk about insomnia. And so that is kind of these problems getting to or staying asleep. And so it's not about not having the opportunity to sleep. It's not that you don't sort of get into bed, but it's that even when you do, you're not able to get that sleep. And then a big one, and I think this is really big after cancer, is what we might call sleep disturbance or disruption. And so these are factors, and they're not just about sleep that disturb your sleep, though. And so that might be things like noise, right? A dog barking or an alarm going off. It can be symptoms, right? So you go to sleep, but you're in pain, and so it's hard to get to sleep because you're experiencing pain. Or you go to sleep and that's okay, but you wake up later with pain. Or you might have hot flushes in the night. if you're going through menopause or you have the kind of chemotherapy-induced menopause. And so you have, you're sleeping and that's fine. And suddenly you're hot and you're sweating and you need to cool down or take off clothes or take off blankets. And that wakes you up. And so that's disturbing or disrupting your sleep. Right. And then, of course, there's other things too, like maybe you have a bed partner and they sleep at a different schedule than you, or they snore, or they turn over in their sleep, right? Or they get out of bed earlier than you, or whatever happens, right, that they're doing, that then also disturbs or disrupts your sleep. And so I think about these as kind of something outside of you, right? Or I guess in the case of symptoms, it's sort of inside, but it's something that's not just about sleep, but because it happens at night, it can also disrupt your sleep. And what we're going to do to try to improve sleep can look really different depending which of these is actually causing sleep problems. And the last point here that I think is really important is that for many of us, it's not just one thing, right? So, my cat will come in and out of bed and wake me up. And I have a partner, and she may come to bed a little bit later than me, and that might wake me up. And I might have a headache when I'm going to sleep, and so that makes it harder to get to sleep. But I'm also trying to get up early to make sure I go to work. And so that is a little bit of this kind of lack of opportunity or whatever other things are, right? So for many people, you have kind of, potentially one or two of these that are really big, but you might also have just little impacts on many of these. And trying to kind of get your sleep the best it can be can involve looking kind of across what are all the causes of your sleep problems and what can we do about all of them. Now, I've talked a few times about, um, sorry, just seeing a whole bunch more Q&A now. Apologies for that. So is blue light from screens an issue? Blue light from screens certainly can be, and that's going to fit in. And also, I'll talk about the circadian mismatch here as well. So first, I want to just sort of talk about, and I've said this a few times, but when we talk about kind of body clock or the circadian rhythm, let's talk about what it is. There's a little diagram here on the left, right? Where we sort of, it might be in the morning, and we sort of get the signal to our brains to be alert. And then over time comes to the evening, and we get a signal that sort of says be sleepy. And then, the following morning again, and the following day, in theory, we sort of get this kind of signal, be alert, be active. So this body clock, it sends this sort of high alerting signals in the morning or the daytime, and low alerting signals that help us sort of rest or sleep in the evening. But people also have slightly different body clocks. Sometimes you might have heard phrases like an evening owl, right? Or a morning lark, right? Somebody who's really a morning person or sort of an evening person. And so people will have different preferences for when they're awake or asleep relative to what we think about as kind of, daytime, nighttime. Most people are what we are calling trained, or they're sort of matched to, roughly speaking, the day and night cycle of the sun. But not everyone is, and not everyone is in exactly the same way. And the reason that most of us are sort of roughly having our body clocks match the cycle of the sun and the night, right, of the day and the night, is because one of the most important features for setting when our internal body clock's rhythm is, so what that cycle is for us, is the light that we get to our eyes. And so the sun is really bright, gives us a lot of light, and that can help sort of tell you, okay, right now, this is morning, I should be awake and I should be active. And it tells your body clock. I don't mean sort of should in what you should be doing, but it sort of is telling your body, right, internally, physiologically, it sets this, be awake, be alert. And then in the evening, the sun goes down, the world is dim and sort of dark. And that sort of, again, supports your body clock in sort of saying, hey, now it is nighttime and rest time. And as that happens repeatedly, our internal, this physiological processes that we have inside of us synchronize, or they match that day-night cycle or that light-dark cycle. And now the question that came in is sort of, is blue light from screens an issue? Where that can be an issue is depending when you're getting that light. So if you're thinking about sort of, light in the morning, darkness in the evening helps keep And doing that sort of on a consistent routine helps your body clock synchronize or stay aligned with a particular pattern. If you then go right in the evening and you suddenly get a whole lot of light um, to your eyes, like from a screen, for example, right? If you use a very bright device or something like that, that will basically confuse your body clock. It's now sending, sort of giving you're getting these light through your eyes, which the eyes then are able to sort of transmit that to our brains and then the rest of the body. And it's saying, hey, this is the time I should be awake and alert. And what sort of happens then is rather than a nicely synchronized clock that sort of says alert, asleep, it sort of starts trying to move because it's thinking, well, maybe there's a different 24-hour time period I should be aligned to. And then you end up sort of with more problems sleeping, more problems with fatigue. So blue from devices, not a problem really in the morning, not a problem in the daytime. You don't want to be having a lot of blue light from devices around evening or around whenever you're trying to sleep. If you're a night worker and so you work night shifts and then you sleep during the day, then this advice would be sort of reversed. But basically, you want to try to minimize the amount of light, and especially bright light and blue light that you get in the few hours before you want to normally sleep. And as much as possible, because our body clock takes time to adjust. And if you think about jet lag, that's what happens when you travel. We can physically travel very quickly in a plane or in a car, but our body clock takes more time to adjust to the new schedule. So when you sort of give light at inconsistent times, you wake up late, or sometimes in the evening you get a lot of bright light, sometimes you don't. Your body clock can't respond that quickly. It takes it several days to change. And blue light is a particular focus because the parts of our bodies that are most sensitive to setting that sort of circadian or body clock timing, they are most sensitive to the wavelength of light that blue light tends to be. So white light, and especially blue-white light, is what triggers the biggest changes to our body clock. Whereas kind of red light doesn't tend to do that as much. We're not as sensitive to it. And then I think the last question here, does circadian mismatch increase cancer risk? So the risk of actually getting cancer. There is some evidence there. Some of the research that's come out of that looked at flight attendants from airplanes. And so those are people who, because they're flying all the time to different time zones, right? It's very hard for them to have a stable schedule and a sort of stable body clock that's aligned with their work and with the signals they're getting, right? Like the amount of light, like daytime, nighttime sorts of things. And there is some evidence that can increase the risk of developing cancer to a degree. Okay, so that's all about sort of the body clock. We'll be coming back to this about what we can do about these things in a little bit. And another really important concept for sleep is what we call sleep drive. It's easy to think about it like hunger. So how hungry are you for sleep? If you have a really strong sleep drive, it's good for getting to sleep quicker and staying asleep longer. Just like hunger, your sleep drive increases the more you're awake, and it decreases when you sleep. And we feel it, kind of the experience of this that you will feel is sort of sleepiness. And so this little graph just sort of shows what that might look like. When you wake up, you have a very low sleep drive. You've just slept, so it should be low. It builds throughout the day, and it builds until you go to sleep that night, and then it falls very quickly, right? And then we sort of start the next day. And then the last kind of basics that I wanted to go over was around sleep hygiene. And I don't really love the term hygiene. It suggests that people that don't do these things are somehow unhygienic, and I think that's not really the right way to think about it remotely. But this is the way that it tends to get talked about. But I'll talk about the sort of the pieces of it. Many of these you're probably already familiar with. But again, it's really good sort of foundation if you're not. And so there's some, they kind of label here lifestyle factors that you can think about. So some things can wake us up, or we call them sort of stimulants, right? They sort of say, hey, be alert, be awake. And that's things like caffeine or nicotine, right? From like cigarette smoke, tobacco, things like that have nicotine in them. And so those are sort of substances that can sort of wake you up. If you are going to use them, one of the recommendations would be not to use them close before bed. So, for example, caffeine, you may like to have a cup of coffee or tea, and that's totally fine in the morning. Um, it takes around 12 hours for caffeine to sort of get cleared out of your system. And so certainly you don't want to be having a cup of coffee a few hours before bed. But really, if you can, it would be best to sort of have anything, with sort of caffeine in it in the morning time. So sort of long before you want to sleep and stop, 8 to 12 hours before you want to sleep would be sort of the safest. And if you are going to have it later, to try to have it as long before you sleep or stop as much before sleep as possible. And similar with nicotine, if you're going to smoke, if you're going to sort of use nicotine, try to use it in the morning. Try not to have it sort of right before you sleep. Then there's some other factors like alcohol. And here it says, limit alcohol. Um, and the advice here is actually going to be somewhat similar. So some people will sort of have, and you'll probably have heard of ideas like a nightcap or something like that to help you fall asleep. And so alcohol is kind of interesting. When you take it, alcohol is actually a bit of a sedative. So it does kind of, it's the opposite of something like caffeine. It kind of can settle you in a way. And so it may help you actually sort of get to sleep initially. But the problem with alcohol is that it doesn't help you get good quality and deep sleep overnight. And so while it might help you fall asleep if you have a nightcap, it doesn't help you get good sleep throughout the night. And so it actually causes you to sort of have a poor quality sleep. So limiting that, again, especially before bedtime if possible. I'm not going to tell you to drink first thing in the morning, but from a sleep perspective, if you could not do it last thing in the evening either, that would be ideal. Diet and exercise can also play a role in this. There's not super strict requirements around sort of eating and sleep, but in general, if you cannot have big meals right before you sleep, that can be helpful. And then conversely, for exercise, we know that exercise can really help and support and promote good sleep. You probably don't want to exercise in the right before bed, and certainly you wouldn't want to do high intensity exercise right before bed. If it was, an hour before you were going to go to sleep and you wanted to do some gentle stretching or gentle movements, there's not really evidence that that sort of thing is a problem. But if you were going to go for, a run or something more intense, I would say probably try to do that a few hours before bedtime. And the flip side of this is if you can actually do some of that during the day or, 2, 3 hours or more before you sleep, exercise can help you fall asleep and stay asleep at night. So it can be quite helpful to support good sleep. Um, so Maya, your question, does meditation and mindfulness help before bed? Or would it be best to do something like that in the morning? That's a really great question. Stuff like meditation and mindfulness, I think, you can do it whenever you would like to do it, but it can be particularly helpful before bed. Um, one of the one of the things that we'll sort of talk about is, and that we know is quite important to sleep, is how active our minds are. So I'm sure all of you have had this experience, right, where you go and you lie down in bed and lights go off and the day's over and there's no more distractions and you start to think about something, right? You start to think about that appointment that's happening tomorrow. You start to think about all the things you need to get done. You start to think about finances or how you're going to sort out some problem. You start to reflect on what happened during the day, things you did or things people did to you. And that sort of thing, and we'll call it sometimes an active mind, right? Or that kind of arousal is not particularly helpful to sleep. And if it's just sort of, your mind's wandering a little bit as you fall asleep, that's not necessarily a problem. But when it sort of turns to tomorrow I've got to get up and get the kids ready. They've been getting up later. I hope that's not a problem for them. I've been so tired lately. How am I going to function well? If I don't do this, there's going to be this problem. Oh, and I need to not forget to, I said I would, send this thing off at 3 p.m. Right? If you have that sort of those active thoughts, that actually makes it very difficult to fall asleep. And mindfulness and meditation, I think, is a really effective way to calm that and bring those kind of thoughts right down to help center yourself. And if you can get in that state, it should be easier to fall asleep. So 100%, if you like mindfulness before bed, go for it. If you like it in the morning, I'm not going to say don't do it in the morning either. But that's one of those things that I think would be a great sort of activity pre-bedtime. All right. So then some other, and they call it bedroom factors here. Again, probably all things that you're pretty familiar with, or just make a lot of common sense because when they don't go well, you sort of wake up and don't feel great. But limiting noise, managing the room temperature where possible, so not too hot, not too cold, managing your body temperature. And that might be quite similar to room temperature, but it can be a little bit more nuanced. Excuse me. Good air quality where you can. So sort of, not smoky, things like that. Limiting or getting light as low as possible. And really low, very, very, very low light is ideal for sleep, close to sort of total darkness. And where relevant, improving bed comfort or your comfort in bed. And so these are all just some sort of, basic components to good sleep. So Andrea, you said I tend to wake up 2 to 3 a.m. most days. Do you have tips of how to fall back to sleep? That's a great question, and I think people will often um, wake up at night, and there's sort of two sides to that we can think about. One is there anything we can do to try to minimize waking up in the first place? And the flip side of that is sometimes we're going to wake up, and then what do we do up sort of about that? Um, a few sort of thoughts and possibilities there. One of them is you can think about, I guess, sort of the thoughts or the reactions that you have when you wake up. And so if you wake up and I'm going to say this and it's going to sound really hard at first, I think, but it's the idea that we're going to try to get to. If you wake up and you're like, oh no, I'm awake again. This is going to be, it's going to take me hours to fall back to sleep. This is really frustrating. And, you get sort of frustrated, upset, that sort of reaction, right? That's going to make it even harder to fall back asleep. And so what I would sort of encourage, I guess, and what we sort of often tell people to do is if you wake up, first of all, see how you're feeling. So, if you wake up at 2 a.m. and, let's say you need to go to the bathroom or you just wake up, if you're still feeling sort of quite sleepy and you feel like, oh, I can fall back asleep, then you might just stay in bed and, stay quiet for a little bit, let the sleep come back. Now, conversely, if you wake up at 2 a.m. and you feel, I'm really quite awake, right? I'm quite alert. I don't feel like I can fall back asleep. And I don't know how to pronounce your name correctly, but Kanta, I think you also sort of said I wake up around 3 a.m. and after that I find it difficult to sleep. So if you wake up and then you're like, I'm not sort of, I'm not sleepy anymore, and that can happen. We talked about sleep drive. So, by 3 a.m., your sleep drive will have fallen already some. So you're probably not as sleepy anymore. One of the things that we will often say is encourage people to sort of get up, get out of bed, but do something very quiet, very restful. What we're basically hoping for is sort of two things. One, if your aim is to get back to sleep, when you get out of bed, you don't want to be doing anything that's going to sort of wake you up more. So if I say, if you feel very alert, rather than trying to force yourself to sleep, So that doesn't work very well. We can't sort of just try really, really hard and knock ourselves out. Um, Instead, rather than fighting yourself, sort of be gentle with yourself, get up and say, okay, I'm alert right now, I'm awake. I'm not going to try to fight myself to sleep. I'm going to get up. But at the same time, you don't want to sort of keep yourself up. So going and doing some quiet activities, um, maybe reading a book, if it's a restful sort of book, could be watching some shows. Again, if they're sort of a calming, resting sort of shows. If you happen to be, we had some questions about meditation. If you happen to be into that, if you wanted to go to the living room and meditate for a little bit or something like that, right? Any sort of quiet, calming activity. And what you're waiting for in that period is that sort of sleepiness wave to come back, that sort of drive for, oh, maybe I can fall asleep. And so maybe you wake up at 2 a.m. and like, there's no way I can fall back asleep. Accept that as much as you're sort of able. You don't want to sort of fight that. You're not going to force yourself to sleep because that doesn't work. And so you get up, you go to the couch and you start reading or you start doing something else quiet. And maybe 2:30, 2:40, you start to feel quite sleepy again. You think, I could fall back asleep. You want to catch that wave, we call it sometimes, that sleepiness wave, and try to go back to sleep, and go back to bed and fall asleep then. The reason that we sort of say, and I'll tell you to sort of, get out of bed, if you feel quite awake and like you won't be able to sleep straight away, is that one, I think a lot of times when people lie in bed wanting to sleep but not sleeping, that kind of becomes immediately frustrating, right? And you think it's only 2 a.m. and I really need more sleep. And then you wait there, right? And then it's 2:15. You're like, I'm still not back asleep. How long is this going to take? I'm wasting time here. I'm not getting anything done. I'm losing sleep, right? Whatever thoughts that you may sort of be having in there. And as that frustration builds, it actually makes it harder to get back to sleep. And so really looking to kind of stop that cycle of, hey, I'm awake and I can't get back to sleep. And rather than make that a frustrating sort of a fight with yourself, which is a fight you can only lose when you fight yourself, right? No matter what happens, it's almost like you lose. Instead of doing that, try to sort of stop that whole process by saying, hey, I'm going to get up and go do something else. What I would suggest, and you can do some pre-planning if you know this happens to you a lot, try to plan and have some activities, that you can do at night when you do wake up that are hopefully enjoyable, but also quite restful or relaxing, so that you sort of have a bit of a plan, when you wake up and you can't sleep, that you can say, okay, I've got this book that I like reading, or I've got, whatever it is that you want to do that you can sort of go and do. You might pre-set up a place, especially if you're getting out of bed. Um, I don't know what Western Australia's temperatures are like in the winter. Here in Victoria, we get a little bit chilly. So, I know it can be sort of hard to get out of bed. So making a cozy little spot that you can go and sit and sort of, stay warm and comfortable and relaxed. And then you're sort of waiting for that to, the next sort of sleepiness wave to come back. And Maya, I see your comment, keeping a sticky note by the bed to take a note that if you wake up with too many thoughts, um, that sort of thing can be really helpful. I think, one of the other strategies that we use, you mentioned mindfulness before, meditation, which I think are great strategies for calming the mind or dealing with a lot of thoughts on your mind. And something else that we often suggest to people is writing it down or setting aside a time for it. So I think, when you have a lot to do or you have a lot of worries, just trying to tell yourself, don't worry, doesn't tend to work very well. But if you say, this is important, I'm going to write it down, or I've got time, set aside a time each day, or set aside a time, in the early evening or something like that. You can kind of a worry time or a time to think through all the thoughts, all the sort of concerns about the next day or planning that you need to do. So that you sort of know that there is a space for that. And then when you have those thoughts, if you have new thoughts, you can write it down or you can acknowledge that thought and sort of know, I'm not ignoring it, but I'm not going to deal with it right now. It's got time that I'm going to deal with it, and it's a little bit in the future. Um, Seeing the questions, sorry, and there's just different spots, the Q&A and the chat about the reading and needing light for it. You can need, obviously, if you read, you'll need some light. And for that sort of thing, what we'll often suggest is stuff like a lamp. Try to have something that's a little bit dimmer, a little bit redder if possible. So you will have some light on, and it's not that you want to sort of avoid all light. And certainly if you are getting up at night or moving around, I think being safe in terms of not falling or not sort of, bumping into things is important. And so some light's helpful for that. But if you can plan some stuff that isn't going to be, super bright light, can be great, I think. All right. Um, and so all these sort of factors, I guess, sort of come together for our sleep body clock and the timing of our body clock matching, when we're actually sleeping and awake. The sleep drive that we talked about. There's this idea about trying to condition or pair bed equals sleep, so that we almost train ourselves. When I get into bed, I sleep. And conversely, when you're not, you don't want to be doing things that are not sleep in bed, at least as much as possible. We know in general for sleep that the quality of sleep can be just as important as the quantity of sleep. So it's not always about getting lots and lots of sleep. If you are asleep for 6 or 7 hours and then after that, you just can't sleep anymore, that might be okay for you. We can think about the thoughts that we might have about sleep. Really common thing and something that people who have insomnia deal with a lot is when they wake up at night, that real frustration, it's sort of, it's happened again. It's going to take me hours to fall asleep. I'm going to be tired tomorrow, right? All those sort of frustrations and irritations that we might have, and that can really sort of make it so much harder, though, to actually get back to sleep. And then really having a quiet mind, a relaxed body, and all of these sort of pieces can come together to support our sleep. Just check. Other questions or comments here? All right. So sort of the last thing I think to go through some, and we've already been starting on this path thanks to, I think, your input. We're going to talk about some of the things that we can actually, the steps we can take to improve sleep. And this isn't a super concrete thing, but it's kind of a high level plan. Um, first, first point I would just make, I guess, when you have sort of insomnia or this difficulty falling or staying asleep, we know that all the research shows that cognitive and behavioral approaches are the gold standard. They're the best treatment, not sort of medications, or we call them hypnotics, like drugs that sort of sedatives or sort of physiologically cause you to sleep. That's not to say that there isn't a place for sleeping medications or other things that you take that might help you sleep, but they're sort of often not the only and sort of not the first line. They're designed normally for short-term use and not for sort of longer-term use. Something else that's going to be really important is trying to identify all of the contributing factors. So what are all of the pieces that are making it harder for you to sleep? As I said, sleep is often complex, right? And there's multiple things. So it might be, that you get hot at night and you also have some pain and you also have some, thoughts or worries, right? Or an active mind. And you also have, you would rather go to sleep later, but you're trying to sleep earlier to make sure you can wake up in time, right? And so there might be sort of several different pieces that all together make it quite hard to sleep well. Then we need to make some sort of plan on how to kind of address those factors that fit into it. And one of my encouragements in that plan, involve your partner or people in your household if you can. I say that just because it can be very hard. We oftentimes think about people as individuals, right? But we are also embedded in households, with partners, etc. And so if you try to change your sleep, and you have sort of okay, I'm going to do these things to sleep better, but then other people in your household are not sort of on board with that, aren't aware of it, or not sort of aren't supportive of that. It can be harder to achieve. right? You want to keep the bedroom really dim, but your partner comes in and always flicks the light on before they climb into bed, right? That sort of thing is going to make it hard to achieve what you want without having them on board as well. As much as possible, address or tackle sort of all factors, right? So changing multiple things. And when I say address and sort of tackle, that doesn't necessarily mean that they are fully resolved or sort of fixed, if you will, right? So there's some things you might still wake up at 2 a.m. and then we have sort of some plan in place. Addressing doesn't mean that you fix it. We're not going for perfection here, but you figure out, are there any steps I can take, and what can you take, and taking those for every sort of factor that's contributing to your sleep. And lastly, be persistent, right? Change can take some weeks to actually achieve. So if you're trying to make some changes and you feel like you're not sleeping much better in the first week, don't be frustrated, don't give up. It's normal that it takes some time, and stick with that. A question here, what does the research show about the use of medical cannabis oil, vape, or gummies to support sleep long term? Um, it's a good question. I don't know long term. We know that short term, it can help some people with sleep. I think it can be helpful in terms sometimes also of things like quieting or calming the mind. There can be some effects shown for pain relief and nausea. And so, if those are sort of problems for you, then you might find that cannabis might be helpful for your sleep. Um, if it's a mistimed sort of thing, like your body clock says go to sleep at 2 a.m. to 10 a.m., but because you have kids or you get up for work or something like that at 8 a.m., you're trying to sort of sleep 2 hours off, then it's probably not going to help very much. And then the other question about sort of long term, I think we just don't really know at this point. Um, we know that as a lot of times when studies are done, they're done over a few months. And that's a great start to evidence, right? But sort of sometimes if you're saying, well, is this something you're going to do for sort of, 5 years or do for the rest of your life? A lot of times we just don't have those studies to actually sort of say, what are the benefits or side effects or anything like that of doing something for many years? So I would say for that, we just don't know exactly in terms of the long term, sort of what does it look like? And another question, is melatonin helpful to promote sleep? Um, Melatonin can be. So there's melatonin is a natural hormone in our body, and our body normally produces, and part of our body clock cycle is actually a cycle of how much melatonin is kind of active in our bodies. And so it rises right before we sleep normally, and then it sort of falls as we sleep. And it's normally we'd have low levels of melatonin in our bodies in the daytime. And melatonin gets used in sleep treatments in kind of two ways often. One aspect, and this is normally a higher dosage, you can use it to try to help you feel sleepier immediately or to stay asleep throughout the night. If you want it to help you feel sleepy immediately, we'd often be looking at what's called sort of an acute release or a fast release, right? So that's sort of, you take the melatonin, right? You take a pill and you want it to very quickly get into your body. And that might help with sort of falling asleep. If you wanted to help you stay asleep, you might need it in your body, at 2 or 3 a.m. when you're going to wake up. And in those cases, it would be better to have sort of a slow release melatonin or a controlled or modified release. And there's capsules designed for that too. Right? You're going to take the pill before you sleep, but you need it to still be kind of releasing in your body at 2 or 3 a.m. or whenever you tend to wake up. And then the other way that we can use melatonin is it's actually one of the very effective ways to change your body clock. So if you tend to go to bed at 2 a.m., your body says, I want to sleep at 2 a.m., but for whatever lifestyle reason, right, you need to be sleeping at 10 p.m. or whatever it is. Melatonin can be a very effective way to move your body clock and change the timing of your body clock to try to align it to your lifestyle or your, whatever you need to do for your life. And for that, we tend to use very tiny doses of it. But the timing becomes really critical. And so if you want to use it in that way, I'd say, you want to work with a professional who can sort of help in that. In the cancer world, there are some studies on melatonin and sleep. There was a review of a bunch of studies that were done in all kinds of cancer, and they overall didn't find a lot of evidence for it providing a lot of hope. And there was another study that was done just in breast cancer, and they found that it did seem to help some people. So I would say there's probably a role for melatonin. I think it's probably not sort of a fix for everyone, and it's probably not sort of a silver bullet, if you will, something like the one thing that sort of fixes everybody's sleep. But it certainly seems like that can have a role and be a help. Um, and the other point I think to this question is melatonin as a sleep tablet okay um, to take and for how long? It's generally melatonin is quite safe. And the best evidence we have, sort of as far out as we have, again, we don't tend to have studies that, last for 4 or 5 years, for example, um, is that for most people, they can take it long term. And we don't think that it's probably likely to have very strong side effects for most people. Certainly, if you have it, I can see a comment there around having an adverse reaction to it, being awake all night. I think if you have that, right, obviously, if you have a reverse reaction to it, I would say, you probably don't want to be taking it. I think it's always sort of wise if you're going to be taking something like this where you can, work with your GP on it, just so that they're aware. It's generally pretty safe and doesn't have a lot of kind of interactions with most other medications, but the medications and health conditions that people have are quite complex, and it's always one of those things where I would not be giving you good evidence. I guess if I said just do it on yourself, I think it would be always good to sort of work with your doctors, other health professionals around it, at least make sure that they're aware of it. And if you're taking it and it helps you get to sleep but not stay asleep, Andrea, then you may find benefit in looking at the slow release options if you don't sort of already, if the whatever you're on isn't already slow release, looking into that, because those are designed to make sure that they're sort of, if you take it normally, it'll sort of get into your body quite quickly, but then the levels will drop, and you may actually need higher levels of melatonin later in the evening when you're waking up or early in the morning. Um, I see a question for is there evidence for herbal teas or tonics like chamomile, lavender, hops, passion flower? There's sort of intermittent research on a variety of these, sometimes as teas, sometimes as like aromatherapies or things like that. Um, I would say in terms of kind of like really robust evidence that they are super helpful, I don't think that that evidence is really there. What I will say is that if you like them, I don't think that there's not a lot of evidence that they're harmful or problematic. If you find them particularly relaxing, if having a cup of chamomile or lavender tea before bed creates a good, relaxing, calming bedtime ritual that sort of helps you quiet down and prepare for sleep, then that's probably on the balance a good thing. And if it doesn't actually help you sleep, I don't think you're likely to do a lot of harm. So I think it's one of those things. If you like it and you want to try it and it seems to work for you, probably great. If not, you can always try something else. Um, Allison, I see a question, a comment around not really getting deep sleep during treatment. Um, and that can definitely happen. And it goes into a little bit of what I was talking about in terms of kind of sleep quality. And so it's sort of not just, getting sleep, but the kinds of sleep that you're getting. And certainly if you're missing out on deep sleep, that's something that you could, that you would feel and that you would notice. And you might say, I slept for 5, 6 hours. But if you weren't getting any deep sleep, you might not feel as refreshed the next day anyway. I haven't heard of that organic mushroom liquid. Um, so I can't comment much on that, but I can look into it. Peck, I see the question, is melatonin addictive? We don't have any evidence that it is. And what I mean sort of by that, I guess, is that one, we don't really have evidence that when you take it, you want to take more and more of it, or conversely, that you need to take more and more to get the same effect. So like, you started off taking 2 milligrams, but after a week, now you need to take 3 milligrams to get the same effect, and then 4 milligrams, and then 5 milligrams, or things like that. there isn't evidence that that sort of building or that kind of developing a tolerance to it so that you need a higher and higher dose to achieve the same benefit, nor is there really evidence that sort of once you're on it, you become addicted, at least physiologically. If you know, sort of feel like, well, whenever I take it, I sleep well. When I don't take it, I don't sleep well. You might become sort of, I guess, if you will, psychologically kind of addicted to it or feeling dependent on it. But I think physiologically, there's not much evidence there. And then, Kanta, your question, can melatonin affect our brain? It does help. It does. There are parts of our brain, I guess, that sort of respond to signals from melatonin. It doesn't generally, to our knowledge, affect kind of how you think or how you feel very much. You might feel a little bit tired. Some people will report feeling tired the next day when they take melatonin. So like it helps them sleep, but they feel like there's some residual effects to it. But it should generally be safe for your brain. Um, Chandrika, I'm just mindful of the time. You happy for us to keep going, or you want to pause here?
Carry on, Josh.
Right. This is just some really practical tips. I'm sure many of you probably already do these things, and might have many other suggestions and strategies that you use. And if you have comments or things that work well for you, put those in. So we think about, can we minimize disruptions to make a quiet, comfortable, dark room? If you have a noisy room and you can't get rid of the noise, can you investigate earplugs? There's a variety of different types of earplugs. You might be able to find one that feels comfortable to you to sleep with. If it's bright, again, of course, if you can use blinds and make it dark, that can work. If not, an eye mask might work. And again, looking for a really comfortable eye mask that sort of doesn't bother you or feels good to sleep in. Partners, pets, kids. Can you talk with them, work together on a plan? It's harder to talk with your pets, but if you learn how, let me know. Pain, you can work with your medical team, get referral to pain or palliative care specialist that might be able to help if pain is regularly impacting your sleep at night. Is there anything that can be done about that? Nausea, you can look into exploring causes, ask about treatments. Hot flushes, lots of strategies on this. People sometimes prefer cotton or kind of breathable materials, having lots of layers that you can kind of more quickly adjust to temperatures, whether that's, you're having a hot flush and you need to quickly get layers off, and then you're cold and you need to get layers back. Maybe keeping a towel around if you sweat a lot to be able to absorb moisture, depending sort of how much you sweat. For bathroom and needing to go to the bathroom at night, if that sort of disrupts you, if you can look into, can you stop drinking a little bit earlier before bed if possible? Sort of how far early do you have to do? If you're a little bit thirsty, can you sip a bit? And making sure that you're balancing that with drinking more earlier if that's what you're doing to make sure that you are still getting enough liquid. I talked about sleep drive before, that hunger for sleep, and we want this to be high for sleep to occur. The things that tend to reduce this, and thus can prevent sleep, is if you sleep in. So if you have a bit of a bad night's sleep, where possible, sort of waking up at the same time anyway. If you don't fall asleep till 2 a.m. and then you fall asleep and you stay asleep until, let's say, noon, but you normally go to bed at 9 p.m., now from noon to 9 p.m. isn't going to be a long enough time for you to have that really high sleep drive that's going to help you get to sleep again. And so what will tend to happen is then the next night, you're also going to have trouble falling asleep because you woke up late and now you want to sort of sleep even later. So trying to minimize sleeping in if possible. Napping also can really reduce tiredness when it's time to sleep. And so while napping, I'm not going to say sort of don't nap, but if you can keep naps short or if you can nap earlier in the day, that can be helpful. I think about napping as kind of like a snack to a meal, right? If you snack right before you try to have a meal, you're going to be less hungry for that meal, and it'll be harder. In the context of sleep, that means it's going to be harder to get to sleep. Obviously, sometimes you might be really tired and really need that nap, and so sort of it's one of those things where I think there's a use your judgment there, but where you can minimize it or move it earlier can be helpful. Caffeine, we talked about before, try to keep that in the morning. And then low activity or rest. Um, if you sort of just, rest or don't do anything all day, that can also make it harder to sleep at night. And so trying to be sort of active during the daytime, as much as you are able to, can help you fall asleep at night. Let me just check the questions again. From Allison, the oncologist prescribed, I don't know how to pronounce this, Alaxine, but the hot flushes worked very well. Now, there's some good treatments and kind of medicines coming out that can help with hot flushes. So it's definitely one of those things, if you're having it and if it's disrupting your sleep, um, talk about it, raise that as a side effect, as a symptom that you're having, and ask what can be done for it. Um, and look into your options, consider the pros and cons, right? But I guess it is increasingly a treatable thing and a manageable sort of thing. um so some concrete tips here for that sleep drive. As much as possible, sort of don't sleep in, nap, or take it easy if you can. Some exercise if it's possible. Quit caffeine late in the day. If you find, it's 4 p.m. and you're quite sleepy, if you can do a little bit of exercise or motion or be active instead. And this doesn't need to be high intensity, right? This can be going outside for a gentle walk. This can be gardening in your garden for a little bit, or something like that can help wake you up or alert you a little bit when you were sort of so sleepy. The combination of the light from being outside plus some activity can help combat that sleepiness or tiredness you might be feeling, without reducing your sleep drive so that at night you're still able to get to sleep. We talk about don't go to bed until you're sleepy. And this is really quite a big one. That means, if you say, well, I normally go to bed at 9 p.m., but 9 p.m. rolls around and you're wide awake and alert and you don't feel like sleeping at all, um, there's not much point in getting to bed. And what we really don't want to have happen is, you go to bed and you lie there for 2 hours, not sleeping, and training yourself that what you do when you go to bed is lie there awake, frustrated that you're not asleep rather than asleep. And so we kind of don't want to condition or pair that, bed with frustration. And so we'll say, if you're not sleepy, don't go to bed. Oftentimes it takes around 16 hours of being awake for people to really be sort of have a high sleep drive and fall asleep quickly. And so that sometimes that might mean going to bed sort of even later if you're not sort of ready for it. Um, for body clocks, I've already talked about sort of what they are, but some concrete strategies in terms of improving it. Because it takes our body clock time to change its timing or its alignment, if you have irregular wake times, that can kind of confuse the body because sometimes you wake up at one point and you're getting light and going then. Sometimes it's at a very different time. So as much as you're able to sort of have a stable or regular wake up time, that can be helpful. Similarly, with activities and what we call exposure to light or dark. So that's, when are you getting, sun in the morning, or when are you getting, when is it dark in your house sort of for the evening? If you can keep that consistent, um, getting sort of bright light in the morning or when you wake up and during the day, making sure that in the few hours before you normally go to sleep, that your lights are dim, using lamps instead of bright overhead lights or things like that. And we talk about a regular wake time instead of a regular sleep time because it's really hard to have a regular sleep time. You can say, I want to go to sleep at 9 p.m., but you're not sleeping at 9 p.m. You can't force yourself to sleep. And so that is quite hard, but you often can, do a little bit more to control when you wake up. And so that even if your sleep time varies around a little bit, if you try to have a consistent wake time and you try to have a consistent routine of when you're active and a consistent routine of when you get light and dim, darkness, that should all help stabilize your body clock, which should help you get good sleep. Comment here. Um, from Jenny, you mentioned that bed should just be for sleeping. Is it okay to read in bed before going to sleep? It should be done before going to bed. Um, it's a great question. I would say ideally you would read before you go to bed, or you would sort of read not in bed, if you can work that out. And this is fitting in again with this sort of idea. We want to sort of pair bed and sleep. I don't know if you will have ever heard of this. There's sort of a famous old psychology experiment of Pavlov and his dogs, where he had dogs and he would give them food, and he noticed before he fed his dogs, they would start to salivate, right? Their mouths would start to be preparing to eat. And then he started to ring a bell before he gave them food, and so he would ring a bell and then give them food. And then eventually he could ring the bell and the dogs would start to salivate without even getting the food. And this is the sort of conditioned response, right? So that your body and the brain is basically now conditioned. When this thing happens, this other thing happens. What we want as much as possible is bed is conditioned with sleep. And if you sort of condition, I get into bed and then I'm awake for a few hours reading or doing something else, that may sort of contribute to, I guess, not sort of conditioning bed and sleep. So if you can do it elsewhere, that would be my first preference. If you do want to read in bed, somewhere else isn't good, or you like to sort of read, and then when you're feeling sleepy, just be able to kind of immediately fall asleep and not have to move to a new place. One thing that we sometimes do is just try to make some little variation between when you're in bed awake versus when you're in bed to sleep. And so that might be like you use one side of the bed to read. And so, you're on the left side of the bed when you're reading. And then when you're ready to go to sleep, you move over to the right side of the bed or something like that. Whatever changes you can make to kind of have a place where you say, hey, this is the place and this is the routine that basically tells my body, now I sleep. And trying to make that different from whatever new routines or anything you do that's sort of saying, hey, I'm awake, I'm reading, I'm doing whatever else. It's a great question, though. Also, sorry, from a few minutes before, question about, I'm going to mispronounce this medication name, Phenergan, I think 25 milligrams, helping to sleep well. I'm not familiar with that drug or that medicine. And so I can't comment on whether it's harmful at all in the long run. I can try to look into it. If you want to send me an email, I'm happy to look into it and get back to you. It might also be a question for your doctor or whoever, sort of someone who may know more about that specifically. We've talked about a quiet mind, right? If you have a really active mind, that can sort of override your sleep drive or those body clock signals. So you could have been awake for a long time. Your body clock should be saying go to sleep. And if I told you there's a fire in the house and you're like, oh no, my house is on fire, right? You're not going to sleep. And of course, it doesn't need to actually be a fire in the house. Just if you have that really busy, active, stressed, worried mind, this can override our ability to sleep. So think about, can you address overall mental activity or busyness, stress, or overload? Where possible, in sort of that evening period, to think about managing sort of incoming stresses. That might be like turning off your phones or emails, or if there's anything that sort of, comes into your life at that point, can you sort of make it so that you don't find out or have to deal with those things till the next day? Good bedtime habits or routines, quiet, calm ones, can help kind of quieting our mind down. So having some routine where, the hour before bed is some relaxing, pleasant, calming activity. Things like relaxation, yoga, mindfulness. When I say exercise here, I don't mean very intense exercises. Talking about just sort of, gentle movements, things like that can be helpful for quieting the mind. Sometimes talking about or journaling or writing about your thoughts and feelings can be useful ways to kind of quiet down the mind. Now, when I say this, especially if it's sort of right before sleep, I think it's almost in that way that someone else sort of mentioned, with like keeping a notepad. If you have, sort of too many thoughts, that you kind of can write some down in order to kind of put them aside. I wouldn't sort of say like, um, you don't want to pick, if you're planning like, oh, I'm going to kind of journal in depth about some really stressful, really difficult, traumatic experience. Plan something like that for the daytime. Don't try to do that, sort of right before sleep, because that kind of journaling about some kind of, reliving or writing down or talking or sort of thinking through, really stressful, really intense or traumatic experiences in the short term is quite arousing. So if that you could sort of do elsewhere. But if you kind of have, you have a lot of thoughts, so you kind of like to journal or sort of take notes on just what happened in the day as a way of kind of processing and quieting down. If that sort of supports you quieting down, that can be helpful for some people. Remember, the goal here is to quiet your mind. So be mindful of yourself, be aware of yourself. If doing it, is making you more alert or is more stressful, then it's probably not something to do before bed. But if it seems to be helping you sort of wind down and get to that calmer place, then it can be a good thing. Setting a worry time and sort of deferring a setting, saying I'm going to worry in my designated worry time. And if it's outside of that and you have a thought, what about this? Saying, I'm going to deal with that, tomorrow at 10 a.m. in my worry time for it. And we sometimes talk about identifying challenging, unhelpful sleep beliefs, which I'll go over a little bit here. See if there's others, questions, comments. Right now, okay. This is just an example of some thoughts and how we might change some of our thoughts about sleep. And the reason that we talk about and we think about this is, I mentioned before, you can't really force sleep. So it's almost impossible for us to force ourselves to sleep. We can try to create the right environment to get to sleep, but you can't sort of force yourself into sleep. What you can do is force yourself out of sleep. And so here's some examples of thoughts that we are quite common and quite natural in many ways, but may not be that helpful. And so it can have thoughts like, if I don't sleep well tonight, I can't function the next day. And an example of a potentially more helpful thought might be, I might not feel 100%, but I'm able to do most things I had planned. I might feel 70%, but that's okay. It's not to say that sleep isn't important to us, but I think the point here is that, getting a thought like, I can't, tomorrow is going to be terrible, is going to make me more frustrated. And the more frustrated I get, actually, the worse I'm going to sleep. So it's trying to kind of reframe or shift how we think into a way of thinking that helps us sort of be more relaxed about sleep. Because when we are more relaxed about sleep, we're actually more likely to get sleep. So another thought here, example, oh no, I can't sleep. It's so frustrating to be awake at this hour. And an example of a reframe, it's not pleasant, but if I keep checking the time or counting the hours, it will only get me more worked up about it and make it harder to sleep. Or another example, I felt so tired all day, it must be my sleep. And it might be many things can affect how you feel during the day. And we talked about sleep, obviously, and we've also talked a little bit about fatigue. After cancer in particular, we know that there's a lot of fatigue that can occur that is not just about your sleep. So there's a difference between sort of how energetic you feel and whether you've had a good night's sleep. And then lastly, I'm trying so hard to sleep, it doesn't come. Maybe I'll be awake all night, right? What if I can't sleep all night or can't sleep until 5 a.m. or, whatever time that you might be worried about? And a more helpful version might be, I can't force myself to sleep, but I can relax each part of my body and rest. Sleep will come when it comes. I think we've already talked about pairing bed and sleep. The only extra bit that I want to sort of add here, two bits maybe. One is this idea of catching the sleepiness wave. And so that's sort of being aware in yourself of when you start to feel quite sleepy. And when you notice that sort of you're starting to feel quite sleepy, be aware of that. And that's when you want to sort of go to bed. If you find yourself in bed, you're wide awake, you're agitated, you can't sleep, stop trying, get out of bed, do something quiet, but be watching and sort of waiting, if you will, not sort of like anxiously and obsessively waiting, but sort of be ready for that next sleepiness wave whenever that comes to say, there's that sleepiness. That's when I can fall asleep. And it's, when you start to have that feeling like I'm getting sleepy, I could fall asleep, that's when you want to be getting into bed. All right. Sorry, I think this is a slide error. This is a slightly prettier version of the other one. That's what I intended to show you, but you got to see the drafted and the bettered version. For insomnia, it's really often kind of combinations of many of these things going on, but we think about it kind of being driven by these combinations of behaviors that may not be that helpful, and then maintained by our bodies and brains associating sort of bed with being awake, not sleep. And it can take weeks to condition that way, and it needs to also be unlearned over weeks. Two of the really important things that we do for people that sort of have more insomnia, sort of opposed to sleep disruptions or things like that, is oftentimes spending a little bit less time in bed, not more. And when say this, what I'm meaning is like, if you, let's say you go to bed at 9 p.m., but you don't actually fall asleep until 11 p.m., then, if that sort of happens night after night after night, right? So you have a pattern of, I go to bed and I try to sleep, but I can't sleep for hours, rather than go to bed and try to sleep and sort of get frustrated because you can't, to actually just say, okay, maybe I'm not going to go to bed until 11 p.m. Right? And so we're trying to say, maybe we can't get as long of sleep, but can you get a block of kind of good quality sleep? And so that might be going to bed a little bit later, or getting up a little bit earlier at a regular time. That going to bed later can help maximize that sleep drive, which can help you actually fall asleep. And that might be especially important for a little bit if you've kind of really developed this, a lot of thoughts, a lot of frustrations, a lot of anxiety around sleep, where you sort of are like, I know what happens. I go to bed and I never sleep. I can never fall asleep, right? And that's terrible. If you want to sort of break that, you want to get some good experiences where you say, hey, actually, I went to bed and I fell asleep in 15 minutes. That's pretty good. And how can we get that? One way that we can get that is by trying to go to bed a little bit later so that you're really sleepy when you go to bed, and it kind of overcomes those thoughts. Keeping the bedroom really a place for sleep or sex, getting non-sleep stuff out of the bedroom, and actually getting out of the bedroom if you're not able to sleep after around 20 or 30 minutes. We talked about this for sleep generally, but this is particularly helpful in the context of insomnia. And the last two things that I want to talk about, sort of most important for last, is when to get other help. And some broad principles. If sleep problems are affecting how you feel beyond occasional issues, that's a good sign that it may be worth getting some more help, getting some professional help. Certainly, if you're concerned about any specific sleep disorders like insomnia disorder or sleep apnea, like the sort of the snoring or you stop breathing overnight, restless leg syndrome, then you want to be going and sort of getting some professional help. The good news is we have a lot of really effective treatments for most sleep disorders. And so I sort of say here, get help early, which is just to say we can often help if you come in and are able to get some help. So don't put it off, because you probably can get some support to feel better for many sleep disorders. In terms of how to get help, a lot of times it'll look like seeing your GP or your primary care physician and getting referral to a specialist. There's a couple of options. Behavioral type sleep management is often provided by psychologists, which here often requires a mental health care plan for Medicare to reimburse them. For some other sleep disorders, you might end up seeing a sleep physician. So for example, for sleep apnea or restless leg movements. And then you might get a referral to a sleep physician as well as a mental health care plan, just so that you're sort of covered by both. If you see your GP, they get you both those referrals, and you should be set up regardless of what sort of support or from whom you need it. Couple of trusted resources with some more info. Sleep Health Foundation has lots of evidence-based fact sheets made by people that know a lot about sleep. Smiling Mind is an app that I quite like for some kind of meditation, mindfulness type things, some relaxation audios, and some resources for generally kind of helping your mind or quieting your mind. And for some more information about sleep and cancer, the Peter MacCallum Cancer Center here in Victoria has this Can Sleep booklet. And you can actually download the booklet for free. It has quite a bit more kind of detail on a lot of what I've talked about today. Here's the link to it, but you can also just search for Peter Mac Can Sleep. And then when you get to the page, you want to find the part that talks about the self-help booklet. And I will close there in terms of content. I really would like to reemphasize, if you've got questions or you'd like to talk sleep after cancer, please feel free to reach out to me. Contact details here. I'm interested in always kind of hearing about these things. And while I do a lot of research in this space, I'm always interested in working with people that are interested in this space as well, and potentially even collaborating on some things. There's lots of times where sometimes being like, oh, here's the program that we have, or working with people can help design programs that are most useful for you, so that rather than say me designing it in a way that I think is great, and then you tell me, this isn't really right for us, hearing from you in the first place can make it better.
That's so fantastic. Thank you so much, Josh. That's been insightful and really helpful. I can see some comments of gratitude coming through. This webinar has been recorded, so we'll do a little brief edit of it and pop it up on our website and our YouTube page. So if you're a practitioner, you can share it with clients and patients. And if it's for yourself, absolutely share it with your friends, your family. And I wish you all peaceful, happy sleep. And thank you again, Dr. Josh Wiley, for your time and your expertise today. We really appreciate it.
Really a pleasure. Always happy to talk about these things. Thank you so much all for your time and attention as well. I know you have many things that you could have done, and I'm humbled that you chose to spend your time with me today.
Thanks, everyone. See you later.